with hips is the strength across the hips. So through here, you've got your pelvic girdle, you've got your pubic bone, attaches to the back of the SI joint, and then your hip sockets are right here. If that glute strength is not sufficient when you're doing any single leg activities, specifically bouncing or going into that pistol squat, if you dance around when you're going into those single leg activities, that tells me that that strength through that hip socket isn't good enough. So what are some things you can do? Number one, check on your balance. If you fall into that hip when you're in a single leg balance, that's a problem. That's going to jam that hip socket into that tendon right there and create a little bit of bursitis. Holding into those hips, sometimes just working on single leg balance is great. Single leg balance while you're moving. Get into more of that control, and you can work into sliding or opening. But the idea is you're keeping all of that control, that's staying stable, and you're moving on that stable base. Another great way are to do, let's see if you can see me, bridging. Yes, you can. Bridging where you're lifting, find that pelvic stability and kick one leg out without shifting. Those are great. They work on pelvic control. You can also lay on your side and do those old-fashioned leg raises. Find the alignment, roll forward where you're isolating that hip. There are a million things you can do. You can do thrusters, you can do squats, you can do clamshells, you can do airplanes. The idea is creating that global strength across the pelvis so that that hip socket isn't getting popped. Try some of those and let me know how they do.